Hello everyone, thank you for having me here today and thanks to the previous speakers. As was mentioned before, my name is Fanney and I come from a non-profit user-based organization called Hugarafl. But first and foremost, I am a young adult, well, youngish adult, who has the personal experience of being a child and a young person in Iceland that had to struggle a lot, both inside the system and outside of it. And that experience has brought me to where I am today. I have very limited time up here, so I will only talk about a few things, but very important things. And for once in my life, I'm just going to get straight to the point. Sorry, I skipped a page, I think. Oh, no. In the past years, we have been focusing more and more on trying to do something for our vulnerable children and our young people who are considered at risk. We had begun taking the concept of early intervention more and more seriously, which is of course positive and a necessary thing. But as I have mentioned before in my public speeches, I fear that we are making a crucial mistake both now and in the past regarding these early interventions and our approach to mental health. The thing is, we tend to take the children when they start showing serious signs of some problems, such as behavioral problems, learning disabilities, social problems, emotional problems, and so on, and then we diagnose a problem in them. The children themselves. We diagnose them with all kinds of disorders, and then we start to treat the child regarding that diagnosis. And I do not agree with this. It's not okay that in our society we allow ourselves to take our most vulnerable children and young people and tell them that there is something wrong with them and that they need to change in order to fit into the boxes that we have created for them. And to me, it is a clear violation towards our most innocent and vulnerable members of society to force them to take on such a huge responsibility, the responsibility of meeting our unrealistic expectations of what is considered normal and acceptable. And it's also not okay that sometimes psychiatric medication is the first treatment offered. And it's definitely not okay that sometimes psychiatric medication is the only treatment offered. Giving children and young people diagnosis and then psychiatric medication is not an excuse for us to say that they are getting the treatment and help that they need. Medication should of course always be an option for everyone, but never the only solution. And it should never be only one factor of the support that is being offered or provided for the child or young person or anyone. What I'm really trying to say with this is that instead of trying to find a way to make our children adjust to the system that we have created, we need to find a way to create a system in society that is more easily adjusted to our children's individual needs. And we also need to provide them with a lot more alternatives. Not everything works for anyone, you know. In my work in Hugarafl, I meet a lot of people every day. I'm the acting president of ungt, our youth group, so I speak with young people every day. And it seems to be a very common thing that young people that have dropped out of school do not have a job and are struggling to live with mental health challenges or battling addiction and so on, that they have traumas in their past. Many of them have lived through traumatic experiences such as abuse, violence, neglect, poverty, loss, bullying, and so on, as we saw clearly here today. I can honestly say that was the case for me as well. They tell me that they're happy to have found Hugarafl because we offer different types of groups for people to work through their past traumas and the difficult consequences that the trauma has left in them. We emphasize on empowerment and on personal recovery, and our services are free to everyone who needs it, who feels they need it. There is no waiting list, there are no requirements for them to apply, no need for referrals from doctors, or for them to live in a certain postal code, or we offer peer-to-peer support groups. Most of our staff and board members have lived experience themselves, yoga, art, music, and much more. People with personal experience and professionals working side by side as equals. Many of them tell me that they have been diagnosed with PTSD, for example, and other disorders, and they say they've always wanted to work on this, but never got the chance. And when I ask them why they never did, the answer is way too often, I just never had the money. And we wonder what effect poverty or low income has on our children and our young people, and the impact is very big. And it is shameful that the bad financial situation of these young people has left them with no real options to get the help and support that they need and so truly deserve. So in my opinion, it's not in the hands of our young people and their families to come up with this money, or the people who work providing these services to get no salary. in my opinion, is in the hands of our government and our ministries to provide money for various alternatives and support various ways for young people to heal, recover, and to find their own path in life and to become a part of the community. It is in the hands of all of us to listen to those who have seen this reality with their own eyes, lived and healed from it. Because recovery is possible for everyone, but it is also personal for everyone. And this is Iceland, we're the Nordic countries. Lack of finance or resources is not an excuse. And that's it for me, thank you.